Good afternoon. I'm Cookeville Mayor Ricky Shelton.
And I'm Putnam County Mayor Randy Porter. This is our COVID-19 coronavirus community update for Friday, March 26th. As of 2 p.m. today, our total number of confirmed positives in Putnam County is 13, which is 2 more than yesterday. As you can see on the state map behind us, the number for the state of Tennessee is at 1,203. This map is only updated once daily at 2 p.m. Any cases added after 2 p.m. will not be included until the next day. The other counties in the Upper Cumberland that have confirmed cases are Cannon with 2, Cumberland has 6, DeKalb has 3, Macon has 1, Overton County has 1, Smith County has 1, and White County has 1. Repeating, in the Upper Cumberland, other counties other than Putnam are Cannon with 2, Cumberland has 6, DeKalb County has 3, Macon County has 1, Overton County has 1, Smith County has 1, and White County has 1. Again, Putnam County has 13 confirmed cases, which is 2 more than yesterday. Just remember, as we told you yesterday, we can only report the actual confirmed cases that have been verified by the State Health Department. There can be more people that have tested positive but have not been verified yet. There are so many doctors' offices, clinics, and labs that are testing, there can be a lag time in getting those results into the state and verified. Will our numbers continue to go up? Probably, but that is nothing we can predict. We can only provide you the facts, not possibilities or guesses. What we will do is be as transparent with you as possible and report to you what we know to be the verified cases by state health. Looking at our history for the past week, last Friday we had our first confirmed case in Putnam County, and today we have 13. If we continue to make sacrifices like we are, such as stay at home and using proper hygiene, hopefully we can continue to keep our numbers low compared to our population. Just remember, if you have symptoms and want to be assessed for the virus, you need to call your primary care provider. Don't show up, but please call them. Our Putnam County Health Department continues to do drive-through assessment and testing. Today, they assessed 82 people and tested 57. The drive-through testing will resume on Monday from 9 a.m. to 3 p.m. at the Health Department, which is located at 701 County Services Drive. Just remember, the symptoms for the coronavirus is the same as several other more common diseases. Just because you have these type symptoms does not mean you have the COVID-19 virus. Again, Putnam County has 13 confirmed cases. The Health Department is doing contact assessments with each one of those to see who they have come in contact with and assess, quarantine, or test anyone else needed. Mayor Shelley?
This is in our community. We must stop the spread. You could have it now and be a carrier with 0 symptoms. When you go home, you need to wash your hands and wipe down anything you touched. This isn't a drill. Some of you will say I'm overreacting or panicking even, but I listen to the experts, including the ones at Cookeville Regional Medical Center. The faster we do this, the faster we can go back to normal. I'm not a doctor. Many of you listening now are not doctors, but we should listen to the experts who care about us and are on the front lines. We've been advised to stand 6 feet apart from others to lower our risk of getting infected with the coronavirus. But how can you tell whether we're standing just far enough away from people or if we need to tell them to back up a little more? I'm not up here just to repeat myself every day, neither is Mayor Porter. I'm standing here because I care for you and our community. I implore you to listen and to follow the directives given by those on the front lines. The Centers for Disease Control and Prevention describes social distancing as remaining out of congregate settings, avoiding mass gatherings, and maintaining distance, approximately 6 feet from others when possible. Why? When someone coughs or sneezes, small drops of liquid spray from their nose or mouth. If you're standing too close, you can breathe in the droplets, which may contain the coronavirus if the person coughing is infected, according to the World Health Organization. The 6 feet of distance rule comes from studies of respiratory physiology. And so without a cough or sneeze, if we exhale, the distance 3 to 6 feet from each other is called the breathing zone. It's in that kind of volume of air that what exhale begins to mix with the air that's already in the room. So if you're standing within 3 to 6 feet, you may well inhale some of what is exhaled. And of course, if you have the virus, then what you're exhaling microscopically contains the virus. 6 feet, which is behind me, you can see this graphic, length of a bed, the width of a vehicle, 2 golden retrievers, or a couch. You get the picture. We must all take personal responsibility to heed the guidance from experts and to do our part to help stop the spread. Use common sense so that you can be part of the solution.
And it all comes down to common sense, folks, and making sure that you use good hygiene and use the social distancing. We live in a great county, and I think most folks are taking heed to this, Mayor Shelton, but we do see some folks that are not. So we ask that everyone please listen and do what's asked of them so that we can get through this thing and hopefully in the shortest time possible. We had a lot of you ask about what businesses and restaurants and so forth are open during this time. So we created a map of Putnam County businesses and restaurants showing the hours and details on carry out and delivery service. To be able to look at this, you can go to our main page on our website at putnamcountytn.gov or either of our mayor Facebook pages. If you own a business and you'd like to be included on the map, there's also a link on our website for you to add your business. Remember, for your business to be on the map, you have to use the link and add it along with the hours of operations. Mayor Shelton?
Yes, and so to go over the executive orders that the governor's issued, I'll remind you again, no social groups of 10 or more. That's events or parties, not referring to workplaces. Restaurants and bars, no on-site dining. You can carry out curbside or delivery. Gyms and fitness centers are closed temporarily. Dentists and surgery centers are to stop all non-emergency procedures. Schools are closed until April 24th, and all state parks are open and daily 7 to 6, but that is only the parks and the trails. That does not include any buildings there. As far as the city, all public services in Cookeville continue as normal, including police and fire protection and all utility services. Highest priority remains the health and safety well-being of our citizens and the employees that deliver these services. City Hall and all other city buildings are closed to the public until further notice. That's Cookeville Performing Arts Center, Cane Creek Rec Center, and the museums. However, Cane Creek Park and Dogwood Park, except Harvest City Playground, are open. It's beautiful yesterday and today and this weekend, so get outdoors and enjoy them while distancing yourself from others, especially on trails. If you have questions about any city service, it's 526-9591 with questions. And here's Cookeville Regional Medical Center CEO Paul Korth with a hospital update.
Thank you, Mayor Shelton. Thank you, Mayor Porter, for allowing me to come give an update today on Cookeville Regional Medical Center's daily activities that we're doing at the medical center. Today, we received 2 positive COVID-19 test results. One of the positive results was a patient that was currently hospitalized at the medical center, and a second was an employee. These 2 cases are not related. The hospitalized patient has been a patient for the past couple days and has been in isolation since his admission. Staff and providers involved in the treatment of this patient have exercised proper precautions as directed by CDC. We take these precautions to protect not only the patient, but to protect our caregivers and protect other patients that are at the medical center. The staff member who was tested positive last worked at the medical center on March 23rd and received a positive test a few days later. That employee is currently self-quarantined at home and is directed by the CDC. We want to reassure our providers, our staff, our community that the medical center is taking the necessary steps to protect our patients, our staff, our family, and our community. We are following the guidelines issued by CDC and doing everything possible to protect those that are taking care of these individuals. We continue to screen all staff members, anybody that comes into the facility. Patients known to be at risk, we're putting them in immediate isolation, along with those individuals that show up with a fever, cough, or symptoms. From the employee standpoint, we are asking them to go home. We are prepared to take care of this. Let me reassure the public and the community that this is not any different than many other illnesses that we take care of and take very seriously on a daily basis. We often have several isolation patients in the facility, so we are well familiar on how to take care of these patients and how to do the protections necessary, not only for that individual patient, but for anybody else that is in the community or into the hospital. Today, our bed capacity, because of our lower inpatient census, we could handle anywhere between 150 and 175 additional inpatients at the medical center. Now, this wouldn't be the traditional way that we take care of it. You take care of those individuals. You may not have a private room, but we have the capability to take care of a large number of increased patients. We have the ability to handle up to approximately 150 patients on respirators or ventilators. I know there's been many questions and many concern in the community about just what is our capacity at the medical center. We've studied that. We're looking at that daily. We have daily meetings not only with the executive team but also with physicians. So we are well prepared and well informed and willing to execute anything and everything that's needed. You've probably seen some recent changes. We've recently done some telemedicine. Many of our physician offices have gone to telemedicine. Though it is not perfect, it is a solution and it is a big help on able to get patients treated when needed. Again, let me reassure the public, let me reassure the community, we are taking this very, very seriously, and we are well prepared to take care of those patients that come to our facility with the COVID-19 virus. Thank you, Mayor Shelton, Mayor Porter. That's all I have.
Thank you, Paul. Appreciate that update on our hospital. We have a great medical center and a great staff at Cookeville Regional, and that services not only Putnam County, but also services the whole Upper Cumberland region. And we appreciate what you and your staff are doing. Just a reminder on our county office closures, as a precaution for our county employees, most of our county offices are closed to walk-ins, but you can still call each office for an appointment. Trustee's office has an outside drop box for tax payment, and the county clerk's office has a drive-through for license tag renewals. Remember, through the governor's new directive, he extended the time on your license tags that you have. So if your license tag is coming up due anytime in the near future, he's extended that out, I think, on down into May or possibly even June. Also, each office has online services that you can use. For a detailed list, if you'd like to see any of the county offices and the closures or the new arrangements, you can go to our website at putnamcountytn.gov. As we told you before, all our sports facilities, community centers, and library are closed as a precaution until further notice. Mayor Shelton.
Everyone must do their part to stop the spread. Our community is great. We always help not just those we love, but our neighbors, strangers, and the community as a whole. Now is the time to help by taking this serious and being part of the solution. This is here now. It affects all ages. I spoke with a parent here in Cookeville whose 15-year-old tested positive. We must be diligent to physical distance. We know it makes a difference. The reason is simple: to protect the health and safety of your family and mine. I've said this every day. I implore our citizens and local businesses to minimize personal interaction, plain and simple. Stay at home as much as possible. So don't panic. Be supportive of one another and wash your hands. Take this seriously and do your part to limit the spread. Make reasonable, educated, common sense decisions. We will get through this, but we must make sacrifices now to come through this in the long term. Continue to pray for our country, our healthcare workers, and our responders. We also have another site that you can access a lot of information on. It's bettercookeville.com, and there's a COVID page on there that has links to local Cookeville, Putnam County, state of Tennessee, and all federal resources. So that's another place that you can get that is bettercookeville.com. So let's choose faith over fear. God bless.
We realize that a lot of the information we're providing you may be a repeat of our previous daily updates, but our goal is to make sure that you have as much information as possible. We notice on our streams that new people are coming on each day, so we will make sure that we get all the information we have out to you. Our goal as mayors is to be as transparent with you as possible, and I think as we get updates, sometimes it's a little frustrating because we only know what is given to us, and we will make sure we pass on to you what that is, and we will continue to do that. You may get tired of us saying that, but your best defense right now is to stay at home as much as possible. You don't need a stay-at-home or a safer-at-home order to tell you that you need to stay at home. Just use some common sense. We understand you have to go out and pick up food, medicines, and groceries, but continue to use common sense. Use good hygiene, social distancing, and don't be in large crowds. All of these things are common sense things that we should all be doing on a day-to-day basis anyway. We live in a great community. We want to take care of each other. Just remember how close we were when the tornado came through and how everyone turned out to help. We need to keep that same attitude as we go forward. You know, we're Putnam County strong. We're Cookeville strong. We live in a great community, and we're going to get through this. We just have to remain calm and work together. Mayor Shelton and I will continue to do our live updates to keep you informed. Our next update, though, will not be until Monday at 4 p.m. unless something major should happen in the meantime. Should we have any major updates, we will come to you as soon as possible. But as of right now, our next update will be Monday at 4 p.m. Also, today's update will be posted on YouTube, where it will have closed caption for anyone needing it. I want to make sure we talk a little bit about our tornado survivors. As we continue to work through this worldwide pandemic, we're still working hard to support and help our tornado survivors and all the families affected by the storms. We as a whole community continue to pray for you, think of you, and support you with volunteers, donations, and we continue to look for any way we can to help carry the burden that's been placed on you and your family. Just remember, we have all kinds of resources available to you. Putnam County TN/survivors. If you're wanting to help with the cleanup and with the task at hand for the tornado that's been left, go to putnamcountytn.gov/volunteer. And please remember to keep us in your prayers and our county, state, and country in your prayers, as on a day-to-day basis, we're trying to do the very best job we can to bring you all the information we can.
That's right.
And we will continue to do that. May God bless you and your family.